Thank you for joining me for episode 169 of the Confidence Through Health podcast, where I speak with Dr. Joseph Palumbo, who is the medical director for a company called Hydrate. And they do IV therapy for vitamins, minerals, things that the micronutrients that your body needs. And so we talked about just that. What's the difference between vitamin therapy through an IV way or through an oral, like more traditional pill that you may be taking? The benefits of both, why it's important, who needs to be looking at IV therapy, and when to do it, like all the ins and outs. We talk a little bit about absorption and, the need to know what you're deficient in and how that affects both your current daily performance, but also your body's ability to repair and recover and be ready for the long term and prevent illness. So it's a great informational episode that I think we can all learn from, and trying to figure out how do we maximize the micronutrients that are available to us. So thank you, Joseph, for being a guest on the Confidence Through Health podcast.
Thank you. Appreciate it. Nice to be here.
So we're going to talk about vitamins. We're going to talk about IV therapy. We're going to talk about hydration a little bit. But before we get into all that, give us a little background about, why are you somebody that can talk to that?
Well, I've been a board certified emergency medicine physician for about the last 12 years and got into the health and wellness space approximately about 7 years ago when I entered into telemedicine, doing hormone replacement therapy and working with the IV clinics, especially with Hydrate. And being the medical director for now, probably approximately 300 franchise or business partners of Hydrate, I delved into this space because, especially after seeing COVID, the need, importance of people's health and wellness, I think, has come to the forefront of their daily activities. Right. By taking vitamins, by taking nutrients, by exercising more, by watching what they eat, watching their weight. So it's been a true blessing to be a part of something to prevent disease rather than to try to help fix it or cure it. Right. So it's a very nice part of medicine to be on because it does. People are happier. People are more seeking the knowledge now, right. And it's very exciting, very large growth in it. So it's a very appreciable side of medicine to be a part of now. I'm very, very enjoyable to take and learn more and more as we go.
Right. Well, and that's one of the reasons why I do this podcast, is to provide people with opportunity or knowledge around how do we prevent the things from happening, right? And
sure,
how do we get ahead of the curve? And you mentioned COVID and the knowledge that all of a sudden people started realizing that, oh my gosh, I'm deficient in this vitamin or that vitamin. Vitamin D became a huge deal, and zinc was big, yeah. Right? And so, we can go to any drugstore and pick up, a supplement pill for calcium, for vitamin D, for zinc, sure. For all these things. There's also the IV therapy, right? In IV therapy, where you're getting vitamins, not necessarily hormone therapy, but vitamin therapy,
right.
How is that? Is it more beneficial? Is it like a niche of you need this at this time? The comparison of it, why is it, I guess, why is it important?
I think that, the best way to start off is, even people today that eat a very what people would like to call clean or healthy diet,
right,
of fruits, vegetables, meats, potatoes, grains, proteins, you're still most likely deficient in a fair amount of vitamins and nutrients. Right. It's unfortunately just part of the pace that we live in America, that we're not taking as much from the soils that right. The nutrients are typically grown and got. So a lot of our foods are still deficient. I mean, if you wanted to pay for a micronutrient testing panel, that would be great, but not everybody has that availability or luxury to do so, yeah. Because it can be expensive. But, I think taking oral supplements definitely have their value. You have to take them, I think, in my opinion, more aggressively and more routinely, right. As you pass through the digestive tract and all that its components come from that. you're breaking it down, getting less and less from absorbed.
Right.
Whereas when you're talking, in IV therapy, you're getting high doses of minerals and vitamins directly into your bloodstream that probably lasts somewhere in the vicinity of a week and a half to even up to 3 weeks in your bloodstream. So it's something that has a lot of value. I know there'll be a lot of naysayers out there that will talk against IV clinics and the need for it. Number one, just most basic, right? Hydration is key. And I mean, when we say how much you have to take in and keep up, and that's a foregone conclusion that I'd have to say somewhere in high percentages that people are grossly dehydrated. So that's one huge value. Right. And then creating the ability to have higher doses of vitamin C and zinc. We saw in COVID, every doctor pushed that, every provider, NIH, et cetera. Yeah. So we knew that it helped improve the immune system. We knew that certain vitamins had value as far as giving energy, giving support. So for all the naysayers that don't agree with it, we've proven, in my opinion, that the benefits of IV therapy, of micronutrients and vitamins and mineral therapies are an important part of maintaining health, wellness, anti-aging, potentially staving off other syndromes, neurological deficits, et cetera. So I think over the last several years, not only did it put it in the forefront, but it showed the great value that it has. And if you have that availability to get it IV versus orally, I would think that the benefits are already known, that you're going to raise the levels in your bloodstream so much higher. You're going to get so much more benefit that with some IV therapy in conjunction with oral therapy, you are maximizing the use of vitamins and nutrients in your system to give yourself the greatest chance to stave off infections, help have your most energized moments, help stave off long-term illnesses.
So it's a matter of if it's in your bloodstream already, because it's obviously going in through the IV, you're not necessarily ingesting it, having to go through the digestive system, having to have the absorption piece to get it into the blood system. It's already there.
Correct.
And so it'll stay there longer until you use it all, and then
you have to if available redose it if possible. Yeah. But I guess the easiest way to say it is like everything has a half-life in our bodies. Sure. And when it gets into that bloodstream, the breakdown is obviously slightly more subjective, one person to another, metabolism, body fat percentages, et cetera. But as a whole, I think the studies have shown somewhere between a week and a half and up to even 3 weeks that the bloodstreams can have higher levels of value from an IV treatment.
Wow, that's amazing.
Yeah, I think, the proof is sort of in the pudding in that regard. Yeah. But I think, like I said, if COVID didn't transpire, I don't think it would have still been brought to the forefront as much. And as a physician that has pushed health and wellness to try to stave off issues and syndromes, that's why it's a fun field to be in, because it has put more people aware, it's put more people on the know, and it's put more people in the idea that they want to do this. Not necessarily IV, but just be healthier, just be better, and trying to take things more seriously about the things that they need to do.
And so I'm assuming that, like, if you could get a mixture, like sort of a cocktail of, like, you could get these vitamins and those vitamins, and like based on if you had the blood testing done to figure out what you're deficient in, or if you just said, based on just a history of, like, okay, I'm tired all the time, I've got these and these, and we'll boost these vitamins to see if that helps.
Yeah, there are definitely vitamins that, in my opinion, go with quote unquote syndromes. Like if you're fatigued, if you're looking to help energize and potentially even lose weight, if you're looking to help your immune system, if you're looking to help improve your hair, skin, and nails. There's no question that there are particular ones that go with such, and that, if you actually, the greatest value would be to do the micronutrient testing to know what you're not getting, and then try to build that back with oral and IV supplements. Right. But as I said, with people that don't either have the time or money to be able to do that, it's not necessary by any stretch of the means. I think you can see how you feel. You are the knower of you the best. And when you have a knowledgeable expert in front of you as a service provider or franchisee or nurse that are in these clinics or part of these mobile clinics, they can give you a lot of insight of the benefits of such.
Right.
And then you need to ask yourself, what is that you do with your living as far as your nutrition, and how are you feeling at this time that you showed up at this clinic or you asked this mobile provider to come to you.
Right.
So yeah, I won't say there's a fix for everything, but if there is a condition that you're trying to help with, that you want to try to see if vitamins and nutrients can be of, I think there's a lot of people that are working within these facilities that are part of these mobile clinics that can give them the symptom, and we'll try to find the helpful cause to help benefit that.
And I think that's beautiful, because one of the things that while I understand and agree with to some level, people when they talk about their nutrition and like, okay, I need to start eating healthier, so I'm going to track my macros, but you can hit the macros correctly and totally miss out on micronutrients that you need, right?
Oh, absolutely, absolutely.
So it's like knowing both is really where you need to be, and having an understanding to make sure that, like, okay, I'm getting all my vitamins that I need, I'm getting all the minerals,
right,
and I'm hitting my macros, and so now I'm going to be a lot closer to where I need to be on a health standpoint.
And that, Jared, what you're talking about is like the truest of optimums, right? I mean, you're talking about something that requires most likely, testing involved, nutritionists involved. I mean, as a physician in this field, I consider myself in a lot better situations than most. I mean, this is not something that you're typically taught in medical school or in further education about, not only nutrition, we understand the importance of nutrition, but breaking that nutrition down so that one body versus another body gets the benefits and usages of what they need. Right. So that is a very taxing, difficult, laborious situation to do. And that's where like testing, nutritionists, dietitians help out with it, because if you really want, as a holistic approach, and I'm not saying, even vegan, I'm just saying like a holistic approach to your life and trying to maximize the benefits of your body to the everyday use, you will need other components than just what There's so much literature out there. It's hard to digest it all, but I definitely believe in getting a counseling session with a dietitian or nutritionist to help with it. And yes, I'll go back to it again, saying if you're able to get a micronutrient testing, that will help break things down to such a minutia. It'll give them the components to be devising plans of IV therapy, oral therapy, nutrition, ingest, and so forth.
Because it's possible that, like, correct me if I'm wrong, but it's possible that, like, you could be deficient in a specific vitamin or mineral, and it can throw multiple systems out of whack.
Oh, sure.
And so you could be dealing with all kinds of different things just because one little nutrient is not where it needs to be.
That is correct. I mean, the usage of vitamin C, zinc, B12, B complex. These are important things that are in our daily diet that we need to get. I mean, there are people who have a condition, even called pernicious anemia, where a person could just be generalized anemic and then broken down into a different level, found that they're deficient in, either folate or B12. And that's purely just that. It has nothing to do about iron. It's a different form of anemia, but nonetheless, it's still an anemia. And it's due to, like you said, a nutrient deficiency. And there's other conditions, of course, that delve into that. And then you find that by taking like vitamin B6 and other B vitamins, that it can help with so many other benefits to neurological issues or cardio protective issues, that it's almost laughable that people don't understand this great importance of something so minor, but yet so greatly important to them.
Yeah. And what's great is that if you can, like, because if you're taking like I took my 5 vitamins this morning, and there, one of them's like 60 milligrams, one of them's like, 100 milligrams, whatever. Like, okay, so that's a really small dosage of that particular, in the grand scheme of things, from like a week standpoint, right? Or for
week,
like a week and a half, 3 weeks time frame, right? So like, if I miss one or two in a row, like, then I'm potentially heading down the deficiency standpoint.
Yeah, and if you didn't help it out with your diet, you might have been deficient to begin with, and you're just trying to hold at the basic level low normal or even
Yeah.
not even normal. You still might be deficient. Yeah.
Right. And that's based on my body absorbing all of it.
Oh, correct.
Right.
That's the
That's not
subjectivity
even,
of it. Yeah.
that's not even looking at like, did I even absorb any of it or did I just get rid of it all?
Correct. That's the unfortunate compounding issue, is that you take this and you don't know, number one, how your body really used it, what
Right.
level it retained, and so forth. So yeah, that's where I think you see nowadays so many different multivitamins or these resources that are out there for it, that because they're trying to show that really at the end of it all, we're just not at an optimum. We live a very rigorous pace. The diet in America, I just never found to be the best. And to get a really appropriate diet, I don't think a lot of people have the time, the ability, to know how to be able to create that. And so supplements like this are great value.
Yeah. And so from what I heard you say earlier is that like if we're getting a higher dose through the IV therapy and it's staying in the bloodstream longer, like it's, for those that can do it, it's a heck of a lot of like, I guess it's like taking a big thing off your to-do list every day.
Oh yeah. And I mean, in the thing that I like to push the most is that it makes you feel better, which makes your body operate at a higher level. I mean, I always try to say the body is the greatest machine that was ever made, in my opinion. Right. And regardless of your opinions, it's just at the end of the day, it needs to be fed. It needs to be nourished. You need to put the premium gasoline into it. Right. And that premium gasoline comes in with the nutrition that you eat, the fluids that you ingest, and typically the supplements that you take. And depending on how all of those interact will depend upon how you feel. So if you want to feel your best, in my opinion, the IV therapy mixed with oral therapy and good nutrition are going to help that body achieve its highest level.
Yeah. And to go back to one of the things you said, and you mentioned earlier, and I did an episode on this months ago, but I fully agree with you that the soil base in this country is not even anywhere close to where it was in the 40s and 50s. And so like to think that like I'm just going to get, I had a conversation with somebody over the weekend and they asked me like, oh, well, what do you think about supplements? And I was like, well, you need to have something. Like, I can't tell you what, based on like how you said earlier, like until you do testing or know what's going on, like I can't tell you what, but like if we dig into it, okay, what have you been eating? How have you been acting? Then we can narrow it down for sure. But everybody needs a supplement of some sort. And I'm not talking about necessarily the stuff you see on social media that's, promoted and like, become our ambassador for this drink or that drink or But, just the basic vitamins and minerals and enzymes that we're getting at maybe 75% less than what we would have gotten in the 40s and 50s from our food.
Yeah, I couldn't really. I know you're speculating on that number as well. I couldn't speculate as well. What the percentage that we've lost due to the way things are grown. I mean, your organic can get very expensive for people, and I respect that. I'm not an only organic person either. But I do believe that everybody needs supplements because I just think that we ask a lot of our bodies to do, and we want them to hopefully live long and have a very vital life, not be inhibited in any way. And I think the best way to do it is to always watch what you're putting in your mouth and be aware of it, because it has a direct impact about how you feel and how you're going to feel years to come. So my opinion, supplements are fantastic. Read up on them, because that's the best thing about having a conversation with any of the patients is when they're knowledgeable about what vitamins are and what the benefits to them. It's a really engaging conversation about how we can help them further with the IV therapy that we're supporting them with, because it's just a bounce back of ideas. And when we're trying to improve them, whether it be immune, energy, appearance, whatnot, it's a great way to have. It's the best to have a great conversation between each side, because if knowledge is out there, you're available to read up on it, and we can help fine tune some of the details. But at the end of the day, if you're able to afford supplements and vitamins and nutrition, even potential IV therapy, I would absolutely advocate for it, because it's shown that it's proven that it is beneficial.
Yeah. And so how quickly, like if somebody's taking obviously like I'm taking a small dose of pills every day to just sort of maintain where I'm at on a baseline,
Mhm.
If somebody does the IV therapy, you said you're going to feel better. Like, how quickly should they say, like, I felt it, I know it's happening, or like, okay, you're going to need to wait a couple days before you're going to feel anything. Like, is there a timeline that most people are like, oh wow, that was effective?
I think there's a lot of placebo effect in the very early onset.
Yeah,
When people are like, "Oh, I feel great within an hour," like, or it's always the classic, "Well, food just runs right through me." Like, no,
yeah,
that's
yeah,
not how the body works. It takes a period of time.
right.
But no, I always say within 24 hours, everything should be maximal at that point. So
Oh,
it's going
cool.
to be a lot quicker than that in most humans. But you want to give a varying of time frames just because it's hard to say
Sure,
per portion.
sure.
So I always say within the full 24 hours, you're going to be at your max benefit. Chances are it is a way sooner than that, within 6 to 8 hours realistically. But as the receptors get saturated, as everything gets saturated and start to be broken down, you're looking very early on, and then carrying through at least a couple of weeks after.
And that's hugely different from what I know from, like, vitamin from a pill, which obviously has a lower dose, because you've got to, like you said before, you've got to make up for the deficiency that you're currently in, and then you can start to get to an additional piece.
Well,
And
and it's hard to consume that
yeah,
much, right? I mean, like, if you want to consume 5 grams, 5,000 milligrams, or 5 grams of vitamin C, that's a lot. If
right,
you want to take in, 4,000 milligrams of omega-3 fatty acid, that may not really agree with your stomach.
right,
Taking 50,000 international units of vitamin D3 is, again, maybe slightly intolerable. So yeah, the vitamin IV therapy is so much easier because you typically pass a lot of the issues of not feeling well, difficult to ingest it, clearly can't absorb it as quickly
right,
as in oral therapy can. So yeah, oral therapy is a great accessory to
right,
IV therapy and good nutrition, is my
right.
opinion.
Okay. Um, and so it would be sort of like, oh, I missed my IV therapy appointment because I went on vacation. Well, okay, take your oral until you come
Oh
back,
yeah,
and
yeah.
then, so that you don't have a big deficiency that we've got to then bounce back from. Because
Oh,
nobody wants
correct.
to live, like, you don't want to live your life in big highs and valleys, peaks and
No,
valleys, and like, you want to be able to maintain just a baseline of good health.
correct. I mean, the car lasts a lot longer if you slowly get it from 0 to 60 rather than getting it to 0 to 60 in 2 seconds and then
Right.
back and forth. So
Yeah.
everybody knows that any machine will work far better if you slowly get there and maintain rather than peaks and troughs. So
Yeah.
100% agree with that.
Yeah. Um, so is there any vitamins that, like, okay, this one has not shown to do well through IV therapy, or like, are there things that are just like, this is more, you still need to go the traditional route to get the best effect out of this one?
You mean traditional route, meaning
I
oral
mean,
therapy?
oral therapy, yeah.
Um, None that are coming off the top of my head that are, unlike certain medications that do, in medications, I'm referring to like prescriptive medications, things of that
Right.
nature. There are some that are absolutely better absorbed orally than IV or
Hmm.
intravascular. But I'm trying to think, like, nothing stands out in the top of my head that is a far superior oral versus IV therapy
Okay.
when it comes to vitamins and nutrients.
Right. And I'm assuming that's because, like, after I asked the question, it hit me, like, I'm assuming that's because, like, we're used to getting these in our body, like, with a pharmaceutical medication. That's something that probably is not being produced, or created in our body, or
Correct.
we haven't been ingesting for all of our life, like we do
Correct.
when we get food and we get our vitamins and minerals, and so we're trying to maximize something we already know, and that our cells already know how to operate with and do all those things.
Yeah, it's natural. I mean, at the end of
Yeah.
the day, we're synthesizing a natural source. So I mean,
Right.
the iron that's in our foods, the B vitamins, vitamin A, D, E, etc., that we could take supplementally or through an IV, etc. Yeah, we're ingesting on a routine basis, hopefully, and that's helping keep the body at an efficient level. But that's the hard part, is that, I
Yeah.
mean, how much are people eating grains, proteins, mixtures of proteins, all the vegetables, fruits, etc., to be able to achieve all of those vitamins and nutrient levels at the height of what they need to be.
Right.
So no, I agree. Like oral supplements are always beneficial to help in lulls, but your body is pretty much used to everything that it's getting in an IV or oral form because hopefully majority of us are ingesting it routinely enough.
Right. Right. And then, I mean, this just hit me, but it may be something that's like, no, but do anybody have like I mean, side effects is probably the wrong word for what I'm looking for here, but like an adverse reaction to IV therapy? Is it like, has that been something that has been?
Yeah, I mean, can higher levels of certain things make you feel bad or have yes, absolutely. And now, is it true? Like, it has to be derivated out a little bit. Is it truly like the actual vitamin or nutrient, or was it the substance that it was reconstituted in? Was it the preservative that was utilized by the pharmacy?
Right.
Can there always be? Yeah, no, there's no question that higher equivalents of certain vitamins can play a role in creating an adverse reaction. All the reason why, in my opinion, speaking to a physician or medical practitioner about it prior to is important. Because like you said, most people are getting these substances daily, weekly, monthly, at least routinely. And then when you put a large equivalent into them from where their baseline was at, it can have an adverse reaction. So yes, vitamins, I think a lot of people think like Tylenol, Motrin, vitamins are benign by nature.
Yeah.
They, for the most part, are. But there are people that have adverse reactions to Tylenol, Motrin, which are as common as anything, just like vitamins and nutrients can. So, it's not that I would handle it with like kit gloves, but in the same aspect, I would look at it that if you're going to start doing consistent therapy and having higher levels in your bloodstream, it would be intelligent, in my opinion, to at least speak to your practitioner about it, and then have a consult with them, meaning the clinic prior to establish what your goals, what your wants are, and try to do it in the right, safest way.
And so, if somebody's not looking at, or if Hydrate is not available where they are, and so they're looking at other clinics. Or they're looking at Hydrate in other clinics and trying to compare and think like, okay, so what's other than like, okay, this, they're going to sit down and they're going to talk to me. They're going to tell me all these things. Like, what are other things that you need to be looking for that are be like, okay, this tells me that this is an above board clinic and above, practice. They know what they're doing versus just like, okay, I'm a nurse and I bought an IV and I'm going to put it in you.
Yeah. Well, I mean, that's a great way to.
I know that's a stretch, but yeah.
I think the best way to look at or to decipher from clinic to clinic is that there's been new fads out there, and I'll use this as probably the best example that I can. NAD has been one of the highest nutrients that's been out recently that people are always asking about. Yeah. And, there's dose ranges on it. Some people will start, at 125, 250, 500, 1,000. And, I'm going to just give my own personal experience from it. I did an intramuscular injection this past week recently, and it gave a very common side effect to it, which was, a little bit of an anxious feeling, a little bit of, slight like dizziness, and even a little bit of shortness of breath for moments. And I mean seconds and moments. Right. But you had higher levels where people will sell and try to get your money. That reaction could be greater. And same thing with the IV form. So you want to do your due diligence, because more is not always better and less is not always better. But in the same aspect, you want to know that what they're practicing under are proper guidelines. And at Hydrate, we have me as the medical director. We have a slew of medical consultants available. We have a clinical pharmacist that is available researching these things, creating these concoctions with me to make sure that they are safe, ethical, and compliant. So we want to be compliant with the pharmacy and medical and nursing boards. We want to be safe for every patient as we can out there. And we want to be ethical about what we're doing for the patient. We don't want to, charging somebody for 1,000 milligrams of NAD, sure, is very profitable, but it is
Sure.
not going to be the safest or best thing for the patient.
Right.
So I would always say, just like you do your research on a lot of things that you purchase, what is going to go within you, which in by choice, it's not like you have to go to this hospital for this treatment.
Right.
You're going by choice. Do some research on it to make sure that they're doing things, because it is, I think, the right thing to do to speak to a physician or medical practitioner prior to you engaging in this therapy. Make sure that they're doing that. Make sure that they're offering that to you. Make sure that the dosages are fitful within range, because it's not only your money that you're spending, but it's going within you, and it can have a very positive reaction, but also a negative. And whereas they may be responsible for that, it's also, in my opinion, the patient's responsibility to know what they're getting and make sure that they're vetting that choice well. Because at Hydrate, we're trying to do the safest, most ethical, most compliant IV clinic out there, not for anything other than the patient safety. At the end of the day, the opportunities come when you're providing a good brand that patients are enjoying, that patients feel that they are getting respected and heard, and that they're getting benefits from with very minimal, if any, issues from it.
Right. Well, and I think that's huge in another standpoint of, oh, well, my buddy went and got IV therapy. He said he loved it. It was great. It was awesome. Made him felt great. And so I went in and, they just gave me the same thing they gave him, and I didn't get the effect, or, whatever. I'm just, of a scenario. And it's like, oh, okay, well, that didn't work. Well, if they didn't sit down and talk to you, then they didn't know what you needed.
Correct. And there's questions and answer time, right? I think just like we're having a dialogue right now, that same dialogue could be generated with the patient and the provider at that time to be able to. So given the fact that it's a choice, like I said, it's not necessarily a need, like you need antibiotics, you need to see doctor care, this is a choice. Delve into it, get some background information on it. You do your due diligence so that you can maximize your time there, maximize hopefully the practitioner's intellect, and maximize your best efforts from whatever you're getting.
Yeah. Well, and so we've talked about Hydrate. So Hydrate is nationwide, correct?
Yes.
And so how does somebody find out more information about Hydrate?
So hydrate.com, HYDREIGHT, a little spin on Hydrate. Hydrate.com, will give you the locations available to where we're at. We are in all 51 states, and it is 51. Washington, D.C. is considered a state in medicine, so I'm not weird. It is 51. But we have sites in Alaska and Hawaii and et cetera. And we have practitioners available to do consults for them in all 51 states as well, and a very knowledgeable nursing staff that are going out doing them for the patients, so they can reach. The easiest way would probably be hydrate.com, and then pick your location. And then when you're traveling, that's an availability as well. If you're going to any destination city or just in an area, you can look them up. They're pretty spread out at this point.
Nice. Is there a reason why it was the spin on Hydrate? Is there do you know?
I actually can't answer that. I really don't even know, what the whole basis behind it. As the medical director, you laugh. That's probably a good question. I should have asked. I never asked that.
I didn't think to ask that ahead of time to dig into that, but I'm sure there's some some reason somewhere. There always is.
Oh, there's always a reason why people want to be unique. Yeah.
But so hydration is a big piece of the puzzle.
Oh, absolutely. Yeah.
And vitamins are a big piece of the puzzle. And 100%. And as opposed to oral therapy where you're just getting the vitamins and you may not reach your maximum or your ideal, I shouldn't say maximum, but your ideal level of hydration for the day.
Correct.
With an IV therapy, you're getting both. At least in the short term, you're going to be hydrated from a liquid standpoint.
Correct.
The vitamins are going to last for a week and a half to 3 weeks, depending on what they are and how your body uses them. And so,
I mean, as we're all approaching that, spring, summertime right now, we're definitely going to be majority of us being outside, exhaustive in the sun, expiring more. No, I mean, hydration is key. Like I said, as an ER doctor that practiced for many years, you always see people that come in with heat sickness and dehydration, et cetera, from your workout events, etc. And I just think that, yeah, hydration is very key. It's amazing how just a little bit of IV fluids does to the system and how it makes you feel, which shows the great importance of being hydrated. And then, yes, vitamins and nutrients to help support the system, to provide the opportunities to be healthier, to be more energized, to be and I don't want to say this in a weird way, but the glowing, the hair, skin, and nails, the ability to improve everything. Yeah, vitamins and nutrients are a key component in that.
Awesome. Well, before we end, is there anything else about Hydrate that you would like us to know about?
Just that, I mean, that it's a great growing company. I'd like to say that we're trying to provide the safest, most ethical and compliant business out there in it. If you want to cross compare, please do. I think it's only smart to do that as a consumer. Right. And I hope that you choose us because of those values that we try to uphold.
Well, and I did research, obviously, before I don't just let anybody come on. I did some research about Hydrate, and while obviously there's other opportunities out there if somebody's looking to compare to, but I definitely think Hydrate is doing the right things and providing the right services, and I think it's a hugely beneficial piece to the health toolkit if somebody is trying to maximize their health, maximize their longevity, and prevent illness and disease. It can be a hugely important piece of it. Oh, yeah. It's a great adjunctive tool. And I want to say the health armamentarium. There's many things that need to come into that. Right. Hydration and vitamins, nutrients, and supplements are grossly a huge tool in America, especially the pace that we all live at. If you have the availability, or you're inquiring, or you're just curious about things, I think we're a great place to start with. And I always say cross compare because I like to think we'll come out on top of that choice. And like I said, just look for things that are important to you, but things that are important to us are being the most safe, ethical, and compliant company out there to provide the best treatment we can for our patients. Right. Well, awesome. Well, thank you, Joseph, for being a guest. Thanks, Jared. Appreciate it.